This is the year almost 2020, and we should not have these types of health disparities in the year 2020.
And about this issue, my father passed away from colon cancer.
I've lost loved ones to tobacco-related illnesses.
We know the Tuskegee Institute story like the back of our hands.
Buffalo is in the midst of a renaissance, from downtown to Amherst, from the waterfront to Cheektowaga. But east of Main Street, Buffalo's African American community is slowly dying.
You know, we're seeing this in a macro way. Certainly people are having individual experiences around health discrepancies, chronic conditions, and loss of life. But when you start peeling it back and you ask a room full of people in a neighborhood, how many of you have hypertension? And there's 90 people in the room, and 87 of them raise their hands in the same neighborhood. You have to say, what is going on? What's happening when you see younger and younger people coming in through the hospital where I worked for many years? Younger and younger people with loss of limb. And they're all in the same zip code areas. You have to say, what is going on?
The data exists. It says Erie County has the worst health disparity in the state of New York, and the center of that problem rests squarely in Buffalo's African American community. The problem isn't that we don't know, it's how do we defend ourselves.
And what I discover as I keep ministering as a pastor, people have no idea what they need to do to live healthy. They have no idea, and even when they have an idea of what to do, we don't have enough healthcare professionals to take care of us as a community. Because healthcare for African Americans is a cultural distinctive, and because of past historical atrocities, we don't really trust. But in order to participate in your own health, you've got to be able to trust the caregiver.
The African American Health Disparities Task Force is convening the Building a Culture of Health and Ending African American Health Disparities Conference, Friday, August 16th and Saturday, August 17th, at the Jacobs School of Medicine and Biomedical Sciences at the University of Buffalo. It's the second year in a row, but this year is different.
One of the outcomes that we're really hoping to accomplish at the end of the conference is that to really ignite, the community to really take action, to get involved, whether that's supporting your local block club in terms of building awareness and educating the community about some of the health disparities, or even talking to their family members, working with their elected officials, holding people accountable for their actions or inactions. One of the things that I believe Martin Luther King said, that we may not remember the words of our enemies, but we will remember the silence of our friends. So therefore, we're hoping that we provide the community with a platform to really exercise their voice, to ignite hope, and for others to take action, to get involved, and to be a part of the movement.
We have 3 just world-class professionals who are African American, who are coming to Buffalo to talk about African American problems. I don't recall that ever happening before. Dr. Ruffin, who is one that helped create within the National Institute of Health, create this kind of response to minority health, right? Him, Dr. Salupu, who's actually running an office in Brooklyn to deal with African American health disparities. My sister, Dr. Lisa Nicholas, who is actually, at UCLA, but also working on issues around women's health, African American women's health. So we have these 3 giants coming to Buffalo to lead us, to guide us, to give us whatever information that they have. But what's so great about these 3 is they've said to us that they're not just coming to lecture us today for this conference, but they want to work shoulder to shoulder with us over time to see this vision of developing this Office of African American Health Disparities come to light. So what's going to make this process unique? It's the power of collaboration, right? It's the power of partnership. It's the power of unity, right? So creating a table where we have healthcare professionals, business leaders, environmentalists, activists, so that the quality of their life will be better, their lives will be longer, and it just makes so much sense.
The Building a Culture of Health and Ending African American Health Disparities Conference is a call to action. The conference at the Jacobs School of Medicine and Biomedical Sciences at the University of Buffalo is Friday, August 16th and Saturday, August 17th. It needs you. It needs your voice. It needs your input. The conference is free. Register at the door. See you then.